All right, guys, I want to welcome you to Heart Health. This is one of my favorite classes because obviously heart disease being one of the number one killers is silent for most people. A lot of people don't know they have heart disease until after they're dead or have already had a heart attack or stroke. So it's really important that we attack heart from the healthy perspective so that we can prevent the heart attack and the heart disease. So if we look at heart attacks and heart disease, we find that many people are living with clogged arteries and are completely clueless about it. In fact, now it's the number one cause of death in America. It looks like, every 36 seconds someone's dying of heart disease and a heart attack, and then 650,000 people dying every year from it. And then we look at how much money it's cost the United States, $219 billion each year. And that number keeps going up and up. So heart disease is a big problem. And the myth is, my grandparents both died of heart disease, so I am too. No, the truth is that heart disease is common in Canada, United States, but it's not normal, okay? And fatty streaks are the first stage of arterial sclerosis, and they were found in arteries in 100% of kids by age 10. So when it's happening to such a young population, we realize it's a lot more lifestyle than it is genetics. Now, genetics does play a role, but it's not the most important factor. The most important factor is our lifestyle and what we can do to prevent it. So remember that 60% of teenagers already have some buildup in their arteries. And remember, 4 to 10% of heart attacks occur before a person is even 45 years old. So again, the answer is prevention. And we look at 1 in 5 heart attacks are silent. And that means they didn't have any warning signs. Now, many people with heart disease, if they don't act quickly, when they have that sudden symptom, they will die. But the early warning signs are you'll have chest pain, okay? You'll have some discomfort in the upper arm, particularly in the left arm. You'll also have some pain in your jaw. It kind of makes you nauseous. It kind of feels like you're going to throw up. You got some flu-like symptoms, some cold sweats, you get a little lightheaded. That means you're actually having the heart attack. Take the baby aspirin or any aspirin pronto. Call 911 immediately. Most of us don't have that nice little warning. Unfortunately, most people don't really have that warning sign. If they do, they don't know how to react to it. They ignore it. My neighbor next door, unfortunately, ignored it. He's no longer with us today at 47. So it's really important that we attack this from the preventive perspective. And remember, several other medical conditions and lifestyle choices can also put people at higher risk, and that includes diabetes, being overweight, obesity, poor diet, physical inactivity, and excessive stress, or alcohol abuse. Those are going to make things worse for you. And remember, the big thing they always talked about was cholesterol. Oh, you got high cholesterol. That's what's causing all the heart disease stuff. Cholesterol is one of those things that's normal in our body. And it's really not the cholesterol that's causing our problems. Because we look at cholesterol, your body makes its own cholesterol. We have good cholesterol and bad cholesterol. So I'm not really a big fan of this cholesterol thing. But I do want to keep the numbers in a normal range. But when they go crazy, I'm not looking to take medications. I'm looking to change my diet and my lifestyle and to make sure my nervous system is working properly. Because remember, just like heart disease and cancer, both of those are silent, and you don't feel any of them for 10 to 15 years. Well, guess what? You don't feel subluxation or your vertebrae out of place for 10 to 15 years either. So when your spine and nervous system gets out of alignment, it short circuits your body's systems, and so then you're more likely to develop any kind of inflammatory disease. And so we look at the truth about cholesterol. We find that oxidation of the cholesterol is really the cause of the heart disease. And the oxidation of cholesterol really comes about from inflammation. And I want to get into inflammation a little bit later, but cholesterol is your body responding to an injury. Inflammation is your body responding to an injury. In the old days, we say, oh, you sprained your ankle, let's ice it. Now we know that's the wrong thing to do because it slows down the healing. It slows down the swelling, but the swelling is a good thing. Inflammation is a good thing. It's your body starting to repair itself. But when you get too much inflammation, then your body reacts to that, and then it starts putting out extra cholesterol, and then it gets oxidized by our lifestyle and the free radicals that we consume. So truth is, oxidation of cholesterol is really what causes heart disease. The second truth is more people have heart attacks with normal cholesterol than elevated cholesterol. You know why that is? Because most of those people are on cholesterol-lowering medications, which doesn't help prevent the heart attack. Third thing is, as truth is there's a higher death rate with lower cholesterol than high, and the statin drugs, Lipitor is probably the most common. They lower cholesterol, but the mortality of heart attack and stroke are not lowered at all. In fact, there's some people saying it actually increases the risk. So Lipitor and statin drugs are one of those things we want to get rid of pretty quickly. Now, what causes high cholesterol? Obviously, our diet, our lifestyle is number one. You know, we're consuming saturated fats from traditionally raised animal products. We're not exercising. We're overweight. We're starting to get a little older. And then we got some bad genes on that side too. And then also, you could have a pre-existing condition like type 2 diabetes, a lot of stress, hypothyroidism, kidney disease, liver disease, medications. The most common medication to increase cholesterol is steroid medications. You know, first they put you on a round of antibiotics and anti-inflammatory pain. Then they start doing a little bit stronger drug called the steroid. And then they do steroids into your body, and that can actually increase your risk of high cholesterol, which then increases that risk of heart disease as well. And then you can have other issues, but the main issue is that when you have high cholesterol, that's just a warning sign. You got other issues going on in your body. Lowering the cholesterol, not necessarily going to lower your risk of heart disease, but getting to the source of the problem will. So then we got the dangers of taking the cholesterol medication, particularly the Lipitor, and you get liver damage, you get neuropathy. People think neuropathy is just a normal part of aging. You get numbness in your feet. You can't feel your feet, your hands sometimes. Neuropathy is huge for that. That's one of the things I always want. Everyone should always know what their A1C level is. You know, your blood sugar level is huge, but if you don't know your A1C level, then you don't know what your average blood level is over a course of 3 months. So you need to have your A1C level below 5.7 or below to make sure that you're in what we call a low inflammatory state when it comes to inflammation, because the number one cause of inflammation is sugar. Now, also, we know that severe joint pain, ligament rupture is also a damage of the medication, Lipitor, statins. Then we also said you have joint pain, you have muscle pain, you have heart muscle gets into a weakened state. We call that heart failure. It limits your protection of cholesterol against cancer, so it can actually increase your risk of cancer. And also these statin drugs can make you more likely for depression. And one of the big things it does is stops the production of CoQ10, which is something your body needs. It's an antioxidant, and that would actually increase the risk. So if anyone you know that's taking a statin drug, they have to get on a nice supplement of CoQ10. But in my opinion, I would do everything I can to get my doctor to take me off the statin drugs, because the statin drugs are not the benefit we thought they were. In fact, they're actually making the problem worse. And here's a little research study here. It showed that there was a 36% increased risk of death when the patients were taking the statin drugs. So few doctors can actually say that there is a reduction in the risk of mortality. So why are we taking these drugs with all these side effects? And the reason is because that's what we've always done. We've always answered every problem with drugs. We've not gotten to the source of any problems. And that's one of the main reasons that medications is now the number one killer in the United States. Because once you have all these symptoms that you're taking these drugs from, they're going to give you more drugs for those other symptoms. So you're getting this downward spiral, and you're increasing your risk of death because your body needs to be healthy, and you're not healthy when you're taking a lot of medications. Now, the statin drugs also cause problems with the liver, and your brain tissue is made up of 60% cholesterol. So a lot of people are having trouble with depression when they're on statin drugs. They're having trouble with mood swings and irritability. So we don't want to take a statin drug really at any cost, and do everything you can to get your doctor to take you off the statin drugs. Look at the side effects of these drugs. You got headaches, you got infections, muscle pain, diarrhea, constipation, joint pain. We see a lot of that. Sinus inflammation, nauseous, and weakness and dizziness. And you know, a lot of people stop these drugs because they're just tired of the side effects. They weren't worth the benefit. And what is the benefit? Well, you die with lower cholesterol. You're not reducing the risk of heart disease according to the research at all, but many doctors are stuck in their old ways, don't want to admit what they were doing was wrong for years, so they keep prescribing, unfortunately, these statin drugs like they're candy, unfortunately. Now, the causes of heart disease, we talked about this earlier, is inflammation. When you damage anything in the body, whether it's an ankle, your body starts producing inflammation to heal the area. So, the worst thing you can do is take an over-the-counter medication or any kind of anti-inflammatory medication because you're slowing the healing process. So the body recognizes this as a issue, and so the arteries constrict and the blood becomes more prone to clot. Okay, so inflammation happens. Okay, and we'll talk about this in a minute, but usually it's poor diet, stress, whatever caused it. When that inflammation happens, then your arteries will constrict, blood pressure goes up, and when the arteries get more narrow, more likely to have a blood clot, which then can cause the heart attack or stroke. Now, when the stress gets, when the arteries get, let's say you have high blood pressure for a long period of time, and it makes the blood vessels expand too much, and they get a scar in there. What happens is with the scar, your body comes back in, puts cholesterol in there to protect the scar, which isn't a problem, it's part of the healing problem. But what happens with that scar is that cholesterol becomes oxidized by our diet and other stresses that we have, and that's what clogs up the artery. So if we keep our inflammation low and we keep our blood pressure normal, then we don't have to worry about this kind of stuff. So the scars inside of our arteries, and then we call that plaque, okay? That constricts the arteries, thickening of the blood, and then predisposes us to high blood pressure, and then of course the heart attacks. So it all kind of starts as a downward spiral when we start going to that realm. And think about this, blood pressure, it used to be normal was 120/80. Now they're trying to lower that number so they can get more people on blood pressure medication. We know that chiropractic care helps people's blood pressure reduce 25%, and most of our studies are showing that just by getting under chiropractic care, not changing any lifestyle at all. So why would we try something more natural? Now, if your blood pressure's off the chart and you can't control it, hey, I agree. Take the blood pressure medication until we can get to the cause of the problem. So blood pressure medication, in my opinion, if you've done all your natural stuff, it's not helping, please take it. It doesn't have hardly any of the side effects that the statin drugs do. And remember, if a chiropractor says it's okay if your blood pressure is really high and you can't control it, take it until we can, but don't think you're going to take it the rest of your life. Take it just until we can get to the source of the problem, okay? So a lot of times we get the spine corrected. That helps reduce the stress. Blood pressure comes down. We change the lifestyle. Also, that helps as well, okay? Now, what causes inflammation? The biggest thing that causes inflammation, and this isn't just my opinion, this is research, it's sugar. And unfortunately, sugar is in everything. It's in ketchup. It's in anything prepackaged. It's got lots of different names, but any kind of grain that you eat, even if it doesn't have added sugar, will turn to sugar. And it will increase your body's ability to produce insulin, which then messes up the cortisol ratio, which then creates more stress, which then creates inflammation, which then creates the arteries swelling, and then the cholesterol comes in to prepare the arteries, and we got the downward spiral. So sugar's number one. So inflammation, we got to stop at all cost. Another thing is we have improper fatty acids. We're eating the wrong kind of fats. We're eating the saturated fats instead of the good fats. And I'll cover that in just a minute. And a lot of times our diet is very acidic. All the processed sugary foods, the man-made meats that we're eating, all those are acidic foods. And it's a wonder we don't have even a worse pH than we do. But acidic foods really increase inflammation, as well as the free radicals from those foods. And then the stress that we have produces more cortisol, which then creates more stress. And then we have poor posture. When you have poor posture, you put stress on the nervous system. And when the nervous system's stressed, that causes inflammation. That's why people in their regular chiropractic care show a 200% stronger immune system and much stronger arteries and lower blood pressure when they have their spines corrected or they're getting adjusted at least once a week. And now they're also finding that when you sit, especially at home on your computer, because your ergonomics aren't as good at home as they are at your office computer, that just 2 hours of sitting, whether it's in the car, any type of sitting that you're doing, just 2 hours of sitting is now creating tremendous amount of inflammation as well. So that's why we need to make sure we correct the ergonomics at our computers, make sure we get up every 2 hours and do what we call the nitro workout, and I'll cover that in just a minute. Now, we talked about sugar and grains. Remember, grains turn to sugar. Refined carbohydrates turn to sugar almost instantly. So we need to make sure that we decrease these foods, okay? And what this does to our body is it decreases the blood sugar level, which then increases cortisol and insulin. When cortisol and insulin are reduced or increased because of the inflammation in the body, your body then releases an enzyme called PLA2, which then increases inflammation. And now we're projecting that that increased PLA2 is now causing 90% of heart diseases. So when that stress increases, then your body has to start releasing the PLA2, which increases more inflammation. Inflammation then causes damage to the cell wall of the arteries, leading to the buildup of the plaque, and then it's amplified by the oxidation of the plaque. Okay? So what we got to do? We got to make sure that we're replacing the bad fats with good fats. We're all deficient of omega-3. Omega-3 is one of the most powerful natural anti-inflammatories there possibly is. And we're all deficient of omega-3. I'll tell you what, there's one other thing we're all deficient of, and this is vitamin D3. We're all deficient of vitamin D3. Nobody's getting the 30 minutes of full body sunshine every day. And where's the sun been anyway? So we all need to be taking a vitamin D3, boost the immune system. And anytime your levels are normal, it's going to make you more susceptible to a strong immune system and less susceptible to the effects of inflammation. So omega-3, and I take, most people need between 1,500 and 3,000 units of omega-3 a day. And that's for people who just have normal diets. If you're not consuming any good wild sockeye salmon or good wild fish, then you're going to probably need more than that, okay? But omega-3, powerful. Do not get the omega-3 that they sell in the grocery stores and the drugstores because they're not processed properly. They're loaded with toxins. Anytime you burp up fish oil, you know you're taking the wrong fish oil, okay? Healthy fats, olive oil. I put olive oil in my shake, extra virgin olive oil in my shake every morning. I put it on my salad. I eat a salad every day. Everybody should eat a salad every day, by the way, okay? Don't mess up a great salad with poor salad dressing. My dressing is extra virgin olive oil, apple cider vinegar, lemon, sea salt, and black pepper added to that. So wonderful salad dressing. And of course, we talked about the fish oil, great fat, coconut fat. Oh, I love coconut oil. Everybody should have a tablespoon of coconut oil a day. It's a really good healthy fat. We can also use it to cook as well. Nuts, I love raw nuts are a wonderful snack for you. It's got great fat in it that we need. And by the way, how well did the low-fat diet? We did the low-fat diet for years, and heart disease went up, 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 up. So please don't be suckered into, oh, I'm getting low fat. I don't care. I want more fat. I don't want sugar. I don't want processed food. I don't want those bad carbs. I don't want those grains. I want to make sure that I am living my life in an anti-inflammatory lifestyle. So my meats are grass-fed meats, wild free-range chicken, deer meat, if you can find some deer meat, any kind of natural food you can possibly eat, that's what you eat. You do not get the farm-raised salmon, you get the wild salmon. Anything in its natural state is going to be an anti-inflammatory, and that's the food you want. You want to avoid those trans fats, canola oil, vegetable oil, commercialized meats, anything pre-packaged in the grocery store is going to be acidic and be unhealthy for you. And by the way, we start talking about acidity, we know that the lower your pH, the more acidic you are, and the more acidic you are, the higher rate of inflammation, okay? So we have to make sure that our lifestyle leads to a balanced pH as well as move towards the alkaline side, okay? So when you're consuming soda pop, which is the worst thing you can possibly consume, it makes your pH so acidic, it takes like 30 glasses of water just to bring you back to neutral. So under no circumstance do we ever drink phosphoric acid, which is in soda pop. Soda pop, in my mind, should be outlawed. It is the most acidic food. It's causing more heart disease than, we used to always say, oh, it's the cholesterol. It was the eggs. No, it's not the food we're eating that raises cholesterol. Cholesterol gets raised by the processed foods we're eating and the sugar that we're eating, okay? So what causes the acidity? Well, you're eating conventionally made farm-raised meats. These cows and chickens never even see the light of sunshine. Okay, they're fed with grains that have been genetically modified. Okay, and injected with hormones and everything else. And so you're raising up the inflammation because you're eating food that's very acidic. Okay, remember, God's natural food is alkaline. It's good for you. It's healthy. When you eat man's food, you raise up your pH, which then raises up. You actually lower your pH, which makes you acidic, and then you make yourself inflamed, causing the heart disease, okay? So all these things, tobacco, alcohol, artificial sweeteners, medications. More medications you take, unfortunately, the healthier you are. We've got a patient well into the 90s that takes no medications, okay? We should all be that way. In fact, he's 95 now, okay? So we all want to be at that level where we don't need medications, okay? And here's that 30 cup of water I talked about with the soda pop, okay? Now, the alkaline diet, first figure out where your pH is, okay? So you can do a little pH test under your tongue. If it turns yellow, you know you're acidic, turns green, you're alkaline, okay? Find out how bad you are and then start working on it. I love the Alkaline Diet and Align Your Health book. Most of you guys already have this book. If you don't, please, this is a keeper. This is one you want to keep the rest of your life. But you want to get this book. And the first thing you want to do is you want to get that diet cleaned up. When your diet's cleaned up and you still have problems with acidity, then you're going to have to add a supplement. We have several, but Greens First is probably one I would start with most people because it tastes good. It's sweetened with stevia, so it's not as bad tasting as some of the other ones. But once you get to where you're okay with the taste, then you can try some other ones. But that's the one we usually start for most people. You take a scoop a day of it. I put a scoop a day in my shake each morning, okay? And actually, my shake is not in the morning. My shake is at 12 o'clock. So another way to lower your inflammation is wait and eat lunch, or I eat my breakfast at lunch. It's a shake. I drink a shake every day, then I eat a salad every day, and then dinner is whatever my wife makes. So intermittent fasting is very powerful for anti-inflammation, okay? It's also very powerful for weight loss. So I try to consume all of my food in an 8-hour window. That means I'm fasting for 16 hours a day, okay? And it's simple because you don't eat after dinner and then you don't eat again the next day until lunchtime. If you've never done intermittent fasting, then start off and just spread your breakfast out an hour each day until you get to that 16-hour window that you want, okay? But when you're fasting, your body is burning. So when you first wake up in the morning, your body is burning fat, okay? That's getting rid of toxins, which is helping clean your arteries out, okay? The worst thing you can do in the morning is drink a glass of orange juice loaded with sugar. Inflammation, blood sugar, insulin, cortisol just jumps through the roof. Don't be fooled into that glass of orange juice in the morning. And then if you want to drink some orange juice, you eat the orange. You don't drink the juice, okay? When God has food, it's good for you. When man processes food, like making the juice out of it, now you took all the good stuff out, which is the fiber and everything else, and now he's processed it. So, you don't want to consume anything that could throw that out of balance. So I do intermittent fasting. If you don't have the Align Your Health book, get it. Talks a little bit about that in the book as well. I love my snacks, raw nuts. I eat those a lot. Free radicals, we all have these because of our lifestyle stress and what we've been going through, and COVID stress, you name it. But stress causes free radicals. Poor diet causes free radicals. We all have them. We all are getting toxic stress from the environment, from the water, from the air. It's everywhere. You can't avoid it. And so I recommend that everyone do a 21-day detox. I told Sam earlier today, I'm on day 25 today because I messed up. And so I had to extend my 21-day out. But if you've never done a cleanse before, I would recommend you know you've got toxins. I'd recommend you start with a daily detox. Do that for a month, okay? And then do the 10-day detox. And then wait about 6 months and do the 21. And now all I do is the 21-day detox. The benefits of the 21-day detox is you will lose about 10 pounds, okay? And it jumpstarts your weight loss program. It also took care of my sweet tooth, my salt tooth, and my overeating tooth. I may eat healthy, but if you give me one cookie, I'll eat the whole box. You give me one scoop of ice cream, I'll eat the whole box. So I don't have to worry about the sweet tooth, salt tooth, overeating tooth because I'm doing the 21-day cleanse, which shrinks my stomach down so that I'm not the 220-pound football player I used to be. I'm right in that normal range for me, okay? My stomach still wants to be 220, but most I really need to be is about 200. So daily detox, 21-day detox, and make sure you get yourself ready for it because when you're doing the 21-day detox or the 10-day detox, you are doing an anti-inflammatory protocol. You're eating the way God wants us to eat, and you're naturally cleaning yourself out, your arteries, your kidneys, your gallbladder. You don't get gallstones, kidney stones when you're doing a detox every 6 months, okay? So, and I got some patients that have been patients of mine for years and have never done the detox. It is step 6 on our essentials. Please do the detox, okay? Now, Omega3, this is the Omega3 I love right here. There's a bunch of different ones we have, but these supplements help you with your heart. The Omega3 on the left, perfect one for you guys. The CoQ10, for you guys that are still taking the statin drugs, you don't have a choice. You got to take a ton of that. Turmeric is a natural anti-inflammatory. It's good for your whole body, joints, everything. Resveratrol is the one that really helps your arteries and ligaments kind of heal. It's also a natural anti-inflammatory as well. And then the Lipomin 4, that's another good one. Supports if your triglycerides are high, that's a good one for that. And the cool thing about all these is that the Omega-3 is the one you're going to take the rest of your life. The others, you just take until you get over what you're going through, okay? But we're all going to take Omega-3 the rest of our lives. Now, the 7 tips to prevent heart disease, it starts with chiropractic. Because if you don't have a healthy nervous system, you're not processing the good food you're eating. You're not processing the good supplements you're eating. And so you have to have an optimally functioning spine and nervous system, which helps us lower our cholesterol, which helps us lower the effects of inflammation. So it starts with a nervous system because that's the master computer of your body. You must have a good nervous system. Remember, you can judge people's nervous system by their posture. If they have a slight forward head posture, just 10 millimeters of forward head posture decreases neurological function by 50%. So we have to make sure that we're all practicing good posture, particularly in our home computers in our cars. And then if you haven't made the posture class, please listen to the posture class. And then we talked about detox earlier. Make a detox workshop. They're all online now as well. And then the fish oil we talked about, but everyone also needs a multivitamin and the daily detox, what we start with. And the other thing we mentioned was the vitamin D3. The fourth thing we talked about was exercise. And we know that sitting is the new smoking, right? And for every 2 hours, you are going to start blood pooling when you sit for 2 hours, and that's going to increase inflammation, and then it's going to start clogging up arteries and everything else. So what we're going to do every 2 hours, you're going to do the nitric oxide workout. I don't have time to explain it to you today, but it's on the website. It's a 2-minute exercise. You do it every 2 hours of sitting. I do it first thing in the morning. It's my cup of coffee. Gets my blood flowing. And it's a great way to start my day. It's a great way to warm up before my exercise program. But if you do it every 2 hours, it spikes your metabolism. It gets rid of inflammation, but it thins the blood. So the reason they call it nitric oxide is because what do you give a person having a heart attack? If you don't have a nitric oxide tablet, you give them an aspirin. But if you do, you give them the nitric oxide tablet because it thins the blood. That's exactly what this does. Thins the blood naturally. And then you want to, once you get that down pat, then you want to start moving into the advanced exercise, which is the max T3, where we're doing high intensity intervals. That helps clean out the arteries as well, increases our natural testosterone as well. So max T3, you'll get that on the advanced exercise class. And then we talk about reducing stress. Everybody's got stress. We know chiropractic care is big on that. My big thing on stress is make sure you're spending your 15 minutes a day in prayer, meditation, Bible study. When I get too busy and I don't have time to get on my knees and ask God for help and I start living life in my own strength, I get humbled quickly and my stress just goes through the roof. But when I'm practicing my Bible study and my meditation and my prayer on a regular basis, it reduces my stress, which reduces my inflammation and then reduces my probability of any kind of heart disease or clogging of the arteries. And then if you haven't made the deep sleep class, make sure you make, there's 20 steps to deep sleep, but you should be waking up naturally without the alarm clock. And then the seventh thing is, please avoid over-the-counter medications and prescription medications at all costs. Do everything you can to make sure your body has a chance to heal itself. And if we need to take some medications temporarily to help us get over the hump, that's fine. I'm okay with that. I just don't want you doing it long-term. Long-term medications have multiple side effects, and we want to avoid them at all costs. Remember, God made our bodies with a natural ability to heal. We just have to remove the interference, allow your body to start healing itself, okay? Now, our 6 essentials, we kind of covered this already. This is what we take all our patients through. You guys are pretty much good on that now. And remember this, that all sickness and disease can only come from 2 things. And this includes heart disease and cancer. It's deficiencies and toxicities. Our number 1 deficiency is decreased nerve flow coming from subluxations that we've adapted to. How do we adapt to them? Poor posture, okay? And then our second thing is our toxins. You know, the number 1 killer in the United States used to be heart disease, but you know what it is now? It's our healthcare system. What's our healthcare system doing? Over-prescribing medications. And so now the toxins that we have are coming from the side effects of medications, as well as our poor diet consuming processed foods of conventionally made meat, which is an inflammatory food, right? And so we have to start getting rid of those things because we know that those toxins are causing our arteries to get inflamed as well, okay? And so the first step we do is we activate our nervous system, and that's why people in chiropractic care live longer, less likely, 250% less likely to have heart disease, 300% less likely for cancer, because when your nervous system is working properly, you work properly. Remember, your nervous system controls everything. Why do we mention this? Because we know people who have perfect diets. We know people who have exercised perfectly. They do everything right. They're young, and yet they die of a heart attack. And you've seen Iron Man, a 36-year-old Iron Man had a heart attack. You know, a 32-year-old Olympian had a heart attack, died. These people in top shape of their lives. So we know that diet and exercise is not enough. We have to do more things to decrease inflammation. It starts with activating your power so that your body can start healing itself. And that's what we want your body to do. And you can't do that without a healthy nervous system because your nervous system controls everything. And if you have friends and family members that have occasional headaches and menstrual problems, high blood pressure, that's just a warning sign there's a problem. You need to get a checkup. Allergies are not normal. You know, neck pain, any kind of symptom is not normal. It's the check engine light on your car's coming on. Take me to Team Chiropractic because I've got a warning sign and I need to get checked. And I've been masking this warning sign either with adaptation or I've been covering it with drugs. Okay? And remember, most people don't realize they have a clogged artery until it's 100% clogged. You've heard plenty of stories. People going to the doctor, well, I got a 98% occluded artery, so I got to go in for a triple bypass. Same thing happens with the neurology. We can have subluxation pinching 90% of the nerve and not feel it till it gets to be 91. Okay? So we don't ever want to wait until we have pain or till we have the heart attack or till we already have the stroke. We want to do everything in our power to prevent it now. And it starts by making sure your nervous system's healthy so that your body can process everything neurologically and you will live a much healthier probability of healthier life, okay? So, number 1, we never judge our health by how we feel because we can adapt to pain just like we can adapt to heart disease or any other kind of cancer or whatever it is, right? So, also, if you guys know people and all you guys have loved ones that need to get under care, this is a special. All they got to do is watch this workshop. You forward this workshop to them, and they'll get their exam and x-ray for only $47. Normally it's $525. That includes their examination, x-ray, and first treatment. If I can't help them, I'll send them somewhere that can, okay? Some people are afraid to get the adjustment done with a crack. We've got the impulse instrument for that. We've got the laser, we got decompression. We got all the equipment we need to help people, even when people are scared of chiropractic care. Remember, just because someone's had a previous chiropractor, did they correct the problem? More than likely, they just treated the symptom. Because guess what 99% of all chiropractors and doctors do? They treat your symptoms based on how you feel or what your insurance pays for. You know you're going to the right doctor when they take a pre-x-ray and a post-x-ray to show you the improvement. If they're not taking the post-x-ray, then by definition, they're just treating the symptom, and your health is no better than when you walked the door. You may feel better, but you're actually making the problem worse because you go out and exercise and you walk and you're hammering the crooked nail and you don't even know it because you're adapting to it with poor posture. So never go to a doctor that has to be controlled by insurance companies, and always go to a doctor that does pre and post x-rays. That way you know you're getting to the core of the problem instead of just treating the symptom. So anyway, hope you guys learned a lot. Any more questions, I'm only a phone call away. Give me a call anytime. Thank you so much. Hope to see you soon. Bye-bye.